There have been huge breakthroughs in the last 2 years in the prevention of heart attacks using medicated stents during an angioplasty procedure. To explain the advances in treating heart problems is Dr. Daniel Kulick of Mission Hospital in Mission Viejo.
The huge breakthrough in the last 2 years has been stents that are coated with a medicine that actually inhibits the scar tissue formation. And those are variants of either chemotherapy agents or antibiotics that are coated on the stent, and when the stent's implanted in your heart, that drug is delivered into the area where the stent is implanted. The drug wears off in about 2 or 3 days. None of it is absorbed systemically, so there's no danger or risk to you. But initially, the initial report said that there was 0 recurrence with those stents. Now, there is some recurrence. When something's too good to be true, it often is, but it's certainly in the 5% range or less, which is an absolutely dramatic. And we see that just in our own cath lab, that the volume of patients coming in for cath, the volume of patients who are coming in with recurrences from their stents has really dropped significantly, which means we're doing a good job in both preventing heart attacks and helping people improve their lifestyle by reducing their chest pain. Usually, if they have chest pain, the first step is to do a test, which is usually a treadmill or some variety of a treadmill. If that's abnormal, they will all be referred to a cardiologist like myself to evaluate. The majority of those people will go on to have an angiogram. Of the people who have an angiogram, out of maybe 10 people, you very well may have 1 or 2 who don't have anything wrong, so-called false normal. There's other causes, or false positive, I should say. There's other causes of chest pain. There are people who have abnormal treadmills and nothing's wrong. But sometimes that's the only way to find out. And that might be, maybe in the 10% range. Of the other people, there are some people who have mild to moderate blockage that isn't severe enough to need a stent or an angioplasty or surgery, and they may be just treated with medicines, and that might be another 3 or 4 of those patients. Usually in our experience, roughly half the people, at least, who get so far as needing an angiogram get something done. Now, the ratio of how many get surgery to how many get an angioplasty or a stent is really changing quite a bit, partly because there's a lot of people that we can stent that 5 or 10 years ago we couldn't have, so that obviously moves them from one category to the other. But surgery has also had a lot of advances, and there are certain instances where surgery is a preferred method of treatment. And it also has to do with, the doctor's choice, the patient's choice. There's a lot of factors that enter into it. The actual procedure, we usually do an angiogram first to just take pictures of the arteries. That usually takes between 10 and 30 minutes. Then the procedure itself for the angioplasty or stent depends upon, again, how many stents we need to put in, how difficult a case is. A very straightforward case would take 15 to 20 minutes. Some cases can take an hour or longer. In general, the initial success rate, meaning you get the stent where you want to go and the results are excellent, is well above 90 to 95%. For the most part, most of the people get better, and it is nice to see someone who you remember from 8 years ago, was very sick or maybe near dying, and now it's been 8 years, you've been taking care of them with their kids and everything, so it is gratifying.